Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
Together
therapist.
we have the most famous physical therapists on the internet.
In our opinion, of course,
Just like
Bob.
riding a bike, isn't it, Brad? We're right back into
back in the saddle again.
it. Okay, chest pain and angina, how to treat and stop pain. That's the title of our program today. We got, there's multiple causes of chest pain, and it always has to be taken very seriously.
Right, and as therapists, we work with people all the time that are compromised as far as in this system. We have to be aware and always alert to these symptoms and then know what to do with them. So it's kind of in our back pocket.
I never discount it. I mean, if someone comes in and they're saying they even have a little chest pain, right away I have it checked out, or I have nursing take a look at it, because it's just that one time you're wrong, you're going to pay.
Right. And that's one thing, you work with patients for 20, 30 years, but in my case, I ended up with chest pain, went to the ER, stayed overnight in the hospital, had it all assessed, and then it really hits home,
Right, when it happens to yourself.
Right,
So.
yep.
By the way, Brad.
Oh, yeah,
If you are new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, go over to the Facebook and like us. We got our own little sign now, Bob and Brad, because Brad and I, as children, we're not liked. It's a sad story, and we're trying to turn things around.
There you go. So, chest pain. First of all, if you have chest pain, does it mean you're having a heart attack?
Not necessarily.
Not necessarily. As a matter of fact, the statistics on that I read is a while back, but it was quite high, higher than I thought, that people that went into the ER with chest pain walked out, like myself, without a heart attack.
But despite that, you have to do that step.
Yeah, because if it is a heart problem,
Right.
your life is literally on the line, and you have to eliminate that possibility.
Even if you have it one time and then you have it again, you have to go in again, right, Brad?
That happened to me.
Yeah.
6 months later.
And you went in again.
I said, my blood pressure is a little high. I've got some issues. And I said, I went in once already. I don't want to go in again. And they said, no, you're going in, because we're not going to do anything. And you go to the ER.
Yeah.
So I rolled my eyes. I thought, there's another $1,000. So I went into the ER, and the same thing, I did not have it.
Right.
But
So
I did feel
again,
better. I felt better.
Well, you're going to help a
Everyone was
lot
better.
of people, Brad, because just by saying that, you're probably saving somebody's life right now.
Sure, yeah. And
So.
you got to get in there. So you might be asking, well, if you don't have a heart problem, what other things can cause heart problems or chest pain or angina? Number one, it could be lung related. So, because obviously your lungs are in your chest. Pleurisy, pneumonia, pulmonary embolism.
My wife had that one, the pleurisy, one time.
Yeah.
So, and she was in college, and we took her in.
Oh, at that age yet,
Yeah,
too. Wow.
yeah,
I know
so.
my dad had it when he was in his 60s. Very painful. So there's a few things with the lung. The other thing is it could be in the GI. The GERD, G-E-R-D.
Gastroesophageal reflux disease.
I like to say GERD, yeah.
Or you could like to say heartburn.
Right,
Yeah.
precisely.
Heartburn can definitely simulate some pretty good chest pains. And generally, I think people after, they've been diagnosed with it and they've had it for a while, they know when it is heartburn.
Yeah. And then the fourth thing, there's another one that you had brought up.
Panic attacks. I just had some friends, I saw one this weekend that who had a panic attack at work, and they took him in. They treated it very seriously. He was short of breath, and it was just purely anxiety. And if you knew his wife, you'd know why.
I hope she's not going to watch
Oh, she's not going to watch us, I hope. So.
I hope. I know they're waiting to get to the treatment part, but you really need to go through these things to separate it out, so you have a clear understanding of the options that may be causing this. The other one, and this is what the doctor told me when I was said and done. I said, so what is causing my chest pain? And they said, oh, it's musculoskeletal.
Right.
And I'm thinking, well, I'm a physical therapist. Musculoskeletal is right up my alley.
Right.
I should know this. And it's
This is in your wheelhouse.
Right. It's like, well, I don't know this. So started doing some homework and then came up with the answer. And actually, according to Mayo Clinic, there was a study done at Mayo Clinic of the people with chest pain symptoms that came into the ER, 30% of them were musculoskeletal.
Wow.
And they got a label for it, costochondritis.
Yep, and we've seen, I actually have friends have had it, and Brad, again, is a great example here because he's had costochondritis.
Right.
So we're speaking to a real patient today.
So should we show them on Sam what we're talking about? Costo refers to the rib. costochondritis, inflammation. And so we got the rib and the sternum, and there is the
cartilage right
that connects the two, because the ribs expand and contract every time you breathe, so there has to be flexibility in this area. And then, should we go to the back side? Along with that, as the ribs expand and you breathe, the ribs come out kind of like
the bucket handle, yeah.
Right, this is a little analogy. Just like this bucket handle shaped kind of like a rib, connection here, connection here.
So you'd be like this, and it comes up like that, right?
Yep. So as you breathe, the rib goes up, and it goes down, it goes up, and of course all of them go together, and they're not going inches. It's a smaller amount, but they go a lot because you breathe, 14 times a minute or whatever you are breathing.
Yeah, it's a constant thing. So.
Right. If back here, there's no cartilage back here, there's actually a joint that connects the rib to the vertebra.
Vertebrae, yeah.
And if those joints, I think of it as like they get rusted shut or they get locked up, that puts more stress
on this side.
This side,
yep.
And that can be the result of inflammation and irritation.
So you're kind of stuck back here. The movement has to happen somewhere.
Right.
So you get hyper movement over here, which irritates it.
Right.
And this was all kind of postulated by Steve August.
Right.
He's a New Zealand therapist, and we think he's brilliant for
Yeah.
coming up with this.
As a matter of fact, he's got a nice video explaining all this in even more detail.
Right. Does a better job than we do.
He does. Yeah, he's a wonderful guy. Very intelligent.
Yeah. So anyway, he came up with a product, right, Brad?
Right, he did. And he calls it the back pod.
Yep.
And what this is for is to release the joints that are froze up back here. And then we call it to mobilize the joints. And this back pod happens to fit very nicely between the shoulder blade and the spinous process, or the spine. You need to get in that muscular area, which is, you may have an inch of muscle there. You got to get through the muscle and get that joint to break loose. And once that happens, it takes the stress off the front, and there you go, success.
And this product is real solid.
Yep.
It's got this rubber, but it's over this really tough plastic. And I know he had I think a video somewhere of a car driving over it, and I can see easily. This thing is really solid. It's designed really well. It is a bit pricey.
Right.
And I mentioned this before. If you go to the reviews on Amazon, you're going to see that everybody liked it, though, and it worked.
Right.
But they all said it was expensive, but it worked.
Right.
And I thought, too, oh, maybe this could be made out of foam or, this whole thing. But no, this thing has to be really solid.
Right.
And because I've been using it for just plain old mid back pain.
Right.
Just pain between the shoulder blades.
You can use it to soft tissue mobilization just to get those muscles to, relax.
Well, one thing, Brad, do you mind if I show on you?
No,
I mean,
go ahead.
You put it, like you said, between the spine and the shoulder blade, but you actually move it up and down a couple inches everywhere. And I do this a fair amount now, Brad. I did it yesterday.
Yep.
And now my back feels really good today. It doesn't always, it felt good right after I did it, but it feels really good the next day.
Sure.
So again, you're going to move it every 2 inches for about 30 seconds. And you want to show how you do it, Brad?
Now, you're at home to use this. Oh, there's one other thing I did want to mention about symptoms that are consistent with costochondritis. Oftentimes, you're going to find along that rib, that cartilage area, you're going to push, and it'll be sensitive, painful.
That's where, yeah, exactly. That's pretty almost the notion that if you push there, that's almost a good sign that you have costochondritis.
All right. So here we go.
So he has you start off with, especially if you're new to this.
Yeah. What you're going to do is you're not going to be on a soft table like this in your bed. You're going to want to go on the floor. A carpeted floor is probably ideal. I'm going to do it up here just so it's easier to film. So we're going to put that down. And what they recommend is to take a towel or two and put over that if you haven't done it before, because it's kind of aggressive.
And then some pillows, too. He mentions a couple pillows, Brad.
That's under the head, right?
Under the head, yeah.
To be honest with you, I didn't use the towels. I went right after it.
I didn't either.
So you may want to do it that way.
If you've got pretty good mobility, you can do it without it. But if your head is up like this, yeah, you need to start with pillows.
Especially, some people, if they're older, their necks are not as flexible, just as the aging process, and if they are a little bit tight. And this is much more comfortable. But as you get more used to it,
then you start taking towels away.
I'm just going to take them right out, and then
you can maybe even take the pillow away eventually.
Sure. And like Bob says, I'm between the shoulder blade and the back right now, and I'm actually going to do a little bit of movement, and I can feel those muscles.
That's what I did too.
Yeah.
And you can actually put your arms up over your head and take some deep breaths while you're doing this. But I'm going to tell you a variation I've done with this, Brad, now.
What's that?
That I've discovered. I actually, if it's too hard on you, you start on the bed. I started on a mattress, and I laid on it, and it was not as aggressive.
I see, yeah.
And it worked actually pretty good. I was like, oh, this would be great, a starting point for someone if they don't want to use the towel or the pillows, just put it on your bed and lay on it.
Right,
still,
yeah. So instead of using the towel, you're putting a soft cushion
Right.
on. Yeah.
Yeah, it worked out good.
And that's what's going on with this because it is soft.
Now he says too, you can put it directly on the spine. Both Brad and I didn't like it on the spine, do you?
No, I like it to get in that muscle. And actually my back just cavitated a couple of times at a point, you know.
You can also, instead of going lengthwise, you can go across. He said on some people, so if you want to, yeah, like that. So, you know, you're going across the back like that instead of, so. But again, I haven't used it that way. It just worked really well for me going up and down the spine, so.
Yeah.
So, and Brad, by the way, since he's been using this, you have not had any episodes of
symptom free.
pain.
As a matter of fact, I was reading Steve, the guy who invented it, his history. He had it for years, and it's no fun because you have chest pain
and you have to take it serious.
Right, and I've been there. They tell me that it's no problem, but you still think, well, maybe this is the problem.
Yeah, maybe this is the big deal now.
So it's nice to get rid of it, and it worked for him. He's been pain-free for many years.
I've got a niece that I'm going to be having her try out because they diagnosed her with it. So, by the way, if you haven't already, make sure you subscribe to us.